Pancreatitis is an inflammatory disorder that affects the pancreas. The pancreas is an organ that helps produce digestive enzymes to help us break down our food, and also produces hormones such as insulin to help us manage our blood sugars. When we have pancreatitis, it may result in malabsorption of our nutrients from our diet. It especially affects fat because most of fat digestion occurs in our small intestine, where some of our digestion of our carbohydrates starts in our mouth and protein digestion starts in our stomach, but fat primarily starts in our small intestine. So it's almost 100% dependent on our pancreas to help us digest our fat. We may see fatty stools, floating stools, greasy stools, if we're malabsorbing fat. Decreased nutritional intake, weight loss because we're not able to absorb our nutrients from our food, or because we eat less altogether. If pancreatitis is severe enough, it can certainly impact how we produce insulin to help manage our blood sugars. One can develop even diabetes from severe pancreatitis if our ability to manage our blood sugars or the ability to produce insulin is not adequate enough to help us manage our blood sugars. The nutrition recommendations for pancreatitis is to first adopt a low-fat diet. This does not mean a fat-free diet, a low-fat diet. There are low-fat, lean cuts of meat or chicken without the skin that's been baked, or fruits and vegetables are automatically fat-free. But how we eat our fat also plays a role. Just to use this meal as an example, small amounts of avocado or maybe a scrambled egg or a slice of cheese can be all tolerated well when eaten individually. But if one's having scrambled eggs with avocado and cheese all together for a morning meal, it may be too much fat for your body to handle. So the key here is to choose low-fat foods, to use low-fat cooking methods such as baking or steaming or roasting or boiling. Do not fry your foods. When it comes to using foods that have fat in them, you can still eat those foods, but use small amounts. And do remember, there's a lot of foods in the diet that are low-fat, fat-free that can make up the bulk of your diet.